You're live.
All right, good morning. This is Senate Health and Welfare. It is May 13th. The end is near, we think. Keep your fingers crossed. So this morning we're taking up some really important confirmations, and we've asked the newest board member, Sarah Teachout, to come in and talk with us about her interest in being on the board and maybe a little bit about your background. Sure. As well. And then it doesn't need to be a long conversation, but Bill might ask you a few questions going ahead.
Sure. Sarah Teachout, thank you very much. I am the newest member of the Green Mountain Care Board, and I really appreciate you having me in to talk about it. I think many of you, but not everyone, know me pretty well because I spent 16 years in the Joint Fiscal Office working on tax and revenue policy for the legislature, which I think was good perspective and background about how we pay for things. The financing of systems is something I think I really bring to the board. And then after that, I spent 8 years in government and media relations for Blue Cross and Blue Shield of Vermont. So I think the health insurance industry experience also really adds to the knowledge base of the other board members. So I know that they've been appreciative and asked me questions. And so I think that's something I definitely bring. You probably all don't know, but I did get a master's in public administration from the Robert F. Wagner School of Public Service at NYU. Quite a long time ago now. And I attended the University of Vermont for undergrad. So a little bit about it. I started last July with the board, so right before our hospital budget hearings, the week before. So it was a pretty intense time to start, and I feel very lucky that I have followed the work of the board for so many years that I at least knew from the outside what what they worked on, and I was a little bit up to speed, but there's certainly a lot to learn in the job. So that was the most intense time at the board, working on that. And then we also, and you've heard all this from other people, but we worked on the notice of service line reduction policy and held the hearing for Rutland Regional Medical Center, which was quite interesting. And I think we all learned a lot from that process. And I know you're, still working to refine how we handle that. But that was really interesting. I've also been appointed to the liaison group with Mike Smith to oversee what's going on with the healthcare transformation at the University of Vermont Medical Center. That's been a very interesting process. I'm excited that we're having a hearing this afternoon where Mike Smith is going to talk about the work with the group and the consultants that they've hired. So that should be, really interesting. And I'm really hoping that I think everyone wants it to be very transparent what's going on and share as much with the public as possible because it means so much to our healthcare system. I was trying to think of all the things we've been working on. Also, the critical access hospital Medicare cost sharing issue has been something that we've all learned a lot about, trying to get up to speed on. And there's a hearing also on that topic today. So it's a big day for it. And I think we're all struggling with how do we protect patients and help the hospitals and move forward? So I don't think we have solutions, but we're still looking at the issues. And then I think you've heard all of this, but there's a lot more that goes on sort of behind the scenes at the board on the administrative side. So the hospital budget rule was updated. The ACO oversight rule and the ACO certification guidance, all kind of processes that it was helpful for me to go through at that ground level. So I feel more up to speed on those. We, of course, worked on the hospital budget guidance for this year, hospital 340B reporting guidance. We've been through several certificate of need applications. So that's a process I wasn't as familiar with. And then we've been reviewing standard and non-standard QHP plan designs. We updated the guidance on silver loading. There's a lot happening in the healthcare space this year. So that's just, the super high, like what we've been working on and, what I've been working on. So I would sum it up by saying I really do enjoy working for the board. Personally, one of the things I like the most is all that there is to learn. That makes the job much more interesting. And as well, you know, how meaningful every decision is. It's pro and con.
Of course.
So, and you all are super familiar with that. So is that brief enough?
No, that's terrific. Thank you. So we get a little bit of who you are, and some of us have worked with you a lot,
Yes.
in both your role in joint fiscal, but then also with Blue Cross and Blue Shield. So appreciate that. So I'll open it up to questions, and I'm going to ask my question first. It's not a simple answer, I don't think, but obviously the board is meant to be an independent organization, separate from both the legislative and the executive branch. And in your experience since July, do you have a sense that the board is independent, and do you believe that it should be independent? It's two things.
Yeah, I think my answer would be yes to both those questions. I mean, from what I've seen and what I've experienced working at the board, I mean, all the board members and the staff really do view our role as being independent, nonpartisan, you know, attempting to you know, make decisions and do the work for everyone in Vermont and not any particular interest group. And I think, you know, the board members themselves. I will also say that's one reason I've stayed kind of far away from this building this year. I felt like I personally needed to create a little separation. And I didn't want the perception that I was, you know, still involved in advocacy work on behalf of any party. So, yeah. And I think it's important to maintain that. And that's something we need to constantly think about in our actions and how we handle the issues.
Thank you. Questions? Ready?
Got one. So just by
Let me
introduction,
ask you this question first. Do you know everyone around? here?
that's what I was going to introduce.
That's-
So I'm probably the only one.
You are
No,
the
Senator.
Yeah.
Okay.
Yes, we worked together a long time
A
ago.
long time ago. So, sorry, Senator Benson.
So I'm John Benson. I represent the Orange District.
Mhm.
But my question would be, in your words, how would you sum up what the primary function is of the Green Mountain Care Board?
Yeah, so that's a hard one. In simplistic terms, I think we are really trying to look across the entire healthcare system in the state of Vermont and make it function better for everyone involved. And I mean, the hospitals, the payers, and Vermonters who need the care. And we're balancing all of those tough issues, as you are as well, and trying to make the best decisions to move us forward, really, into a place. I think we're in a really tough spot in healthcare right now. And so we're focused on affordability for certain, but we're also looking at the sustainability of the system. We want to make it work for providers. We want to make it work for patients. We want it to be way more transparent than it is currently. And I think we share a lot of the same goals. Maybe the means could be a little bit different, but you know, I think that's what we're doing. I have been asked, and I'll just put it out there a lot, like, why does the board exist and why does Vermont need a Green Mountain Care Board? And it's certainly something I think about. You know, if our healthcare system was functioning perfectly, maybe the role could be a lot more minimal. But it's not functioning well. It's really sort of a broken system. And so we're trying to push different aspects of it to move us in a better place. And it's not just the board, it's everyone involved.
One thing where I get confused is the responsibilities of the Green Mountain Care Board and AHS. They seem to get blurred, and I don't understand it. And I wish that there was some guardrails or something there, because I get confused.
Yeah, I think that others get confused too. And it's something that the legislature, I believe, has wrestled with several times, you know, moving different regulatory oversight rules from one to the other. It hasn't always been the way it is now. And, you know, I think that the Green Mountain Care Board is trying to stick to the regulatory oversight of the hospitals, the payers, And then the ACOs, we have a lot of, statutory authority over certain areas. And I know that AHS is really focused on the reform, aspect. And there was an effort by this committee, I can't remember how many years ago now, to separate those two. And I think we're trying to, stay within our lanes. But sometimes it's not always clear because all of these things impact the healthcare system and our, intermesh, I guess I would say.
I will add just one thing, and that is we have endeavored to put the word collaboration into every bill. And last year or the year before, the Health Reform Oversight Committee had a very intense meeting where we brought folks in together talking about collaboration. Your question is a really good one, and we appreciate the tension that exists there. Question about it.
I have a question. You sort of touched on this already, but it is something that comes up occasionally for me as with my constituents and folks that I speak to who come to me complaining very loudly about the cost of healthcare in the state of Vermont. But then in their next breath, they'll say, but we don't like any kind of regulation. And I sit there and it's funny, I hear that quite often. So I'm wondering if you could just respond to that.
I mean, I think that's sort of the nature of democratic society, really, right? We all want our freedoms, but we want it to work and function, which requires some regulation. And I think as board members, we are always thinking about like how much is too much. Like, we want to regulate the system. I personally think with a light touch, but when it's not working, you need to and so I think balancing that is a constant process. And in every area that we regulate, a little bit different, right? So the way we approach it with hospitals is a little bit different than we do with insurers and different than we're doing with ACOs and, all of the different aspects of the health system. So I don't know if that answers it.
Yeah, no, thanks. I always find it an interesting question because to me it seems fairly obvious, but everyone has a different angle. So
Yeah.
thank you. Appreciate that.
Okay. Other questions?
Thank you.
Thank you.
Let me think of something really. Okay.
I know you're working on a million tough issues, so.
We are, but we appreciate the work that you're doing and we look forward to, we'll hear back from you from time to time. And know that you're integral to the workings of the board and know the experience that you bring to that board.
How long is your term?
4.5 years. I'm filling out, Robin, the end of Robin. Okay.
So that would be 30, no, 2020. Somewhere in
I
there.
can't remember. I would have to look, but it's 4.5 years from last July.
Yeah.
So
20,
I think it's
2030,
29 or 40.
January or something like that. Yeah, sure. Okay.
I
Good.
can look it up and let you know.
Yeah, that's fine.
And then is there always the option to renew or?
Mhm.
Okay.
Yes.
You don't have to go through the whole nomination process again. There are some things you have to do. I know
Yeah.
we modified the bill a couple of years ago. I don't remember.
Yeah, I don't remember either, but I have 4.5 years. So.
It's in 134, which is interesting. It's in that bill at the end of the bill with all of the updating on the
Right.
nominating, committee and process, how long they have until, before they're intending to leave, how much notice that is.
I forgot.
Yeah.
I'm on the nominating committee, but we tend to go very quiet unless there's something very specific work for us to do. So I would.
No, you don't go to work until there's a nomination
Right.
coming up.
Right, so we'll see.
Or we actually met a couple of times when I was on it, just to look at what needed to happen
Yeah.
to improve the process. So at some point, it would be good to hear your perspective on how to improve that process since you've been through it.
Sure. Happy to share.
We don't need to get into
Not
that.
right now.
Okay, well, thank you. Thank you very
you.
much.
Yep.
Appreciate it. Good luck.
Thank you.
Is Sandy coming in person or over Zoom?
Oh, Sandy. Okay,
So,
good. Well, we got a couple minutes. We have 15.
Great.
So I would, ask for discussion about, Senator Gulick has brought, Sarah Teach out in for, to be approved and nominated. Their motion to send for confirmation to the full Senate.
I'll make a motion to send Sarah Truesdale's nomination to the full Senate, to the Green Mountain Care Board.
Discussion? Okay. And you have her for us.
I think she's a strong candidate. And I support her. Yes, I do.
All right. Okay, so let's do this. Should do this, I think. Straw poll, whether it's normal or straw. I think we've always just raised our hands for that time. Yeah,
Yeah.
you want to do a full,
I thought it was a vote for
it is vote for the confirmation.
Yeah,
So I'm just gonna say, all those in favor
Okay.
of confirming Sarah Teach out, and sending to the full Senate for confirmation.
Aye.
Aye.
Aye. Opposed? Okay, and we can, I think Senator Julie Gill report this, via underlined up on the calendar.
sure.
And I'm fine with your reaching out to Senator Cummings, for her vote, because she's worked with her.
Yeah,
Want to vote.
okay.
All right, good.
In the interim, I'm happy to talk about Gail Falk.
Okay, you
Um,
could do that one, and then I have one as well. Oh, good. So let's start with Senator Kulik, and then we'll go to Senator Benson.
Actually, go ahead, Senator Benson, because this does not have all the information I was looking for. If you want to start, that's fine.
So, first one I have is Rick Hildebrand for Commissioner of the Department of Health.
Let's start with that one.
And he has indicated his desire to remain in that position. And has sent me, just an abbreviated, bio, which indicates that he was appointed to Commissioner of Health by the governor, in October 13th of 2025. For his appointment, he served several leadership roles at the Rutland Regional Medical Center, including Chief Medical Information Officer, Chair of the our medical director of the hospital. He has also served as on municipal boards, including the chair of the board of medical practice. He earned his doctorate of medicine from Derek, let me pronounce it, Drexel University College. Drexel, there we go. College of Medicine and a Master's of Business Administration from the University of Massachusetts. He completed his residency in internal medicine at Dartmouth Hitchcock Medical Center, and is clinical assistant professor at the University of Vermont's College of Medicine. As a practicing internal medicine hospitalist, Dr. Hildebrand has been firsthand how social and environmental factors shape the health of Vermonters. His experience led him to pursue population health initiatives that address the broader needs of patients and communities. He is inspired by the collaboration work of nurses, public health professionals, administrators, allied health staff, policymakers and physicians who share the goal of improving health of Vermont communities.
Okay, and we've had, when we invited him in earlier in the session, we indicated that that would be his confirmation hearing, and so now we have a little bit more about his background to refresh our memories, and we know we worked with the Department of Health and Commissioner Hildebrand during the session. So are there any concerns about this appointment?
None at all.
Okay, but not here either. So I would ask for a motion to send Rick Hildebrand's name to be confirmed by the full Senate as Commissioner of Health.
I will make that motion.
Good motion. Okay. So,
I didn't need to repeat it all.
all those in favor? Aye, opposed? We're good. So we can deliver that top to Secretary Bloomer.
Hang on to that.
You hold on to that. His name will be underlined in the calendar. And then he'll be called up for confirmation, and you'll give a floor report as you just did in here as to why we're making that confirmation. So it's board members, Grand Care board members, commissioners, deputy commissioners, secretaries are all underlined. So some of the ones we're doing today are underlined.
So I'm one of the non-underlined
Okay, good.
folks, and actually, she was assigned to Senator Cummings, but Senator Cummings told me to do this because she probably wouldn't be there.
Okay.
Gail Falk, who is one of the public members on the board of medical practice. She's done 5 years already. This will be her second term. She worked for the Office of Public Guardianship. She has a child with developmental disabilities. She really loves the work, and she's excited to continue.
Okay. Any concerns?
And
Senator Cummings recommended.
Senator Cummings sounded great and recommends her. Yeah.
All
And
right.
then there's a Suzanne Jones. Did someone call her?
Yes.
She did. Okay.
Like that.
So let's do, what's your first name? Gail. Gail Paul. Okay, do you want to make a motion on that one?
Sure. Do we have to do that for the non?
Yes.
Okay. I'll make a motion to recommend Gail Falk to the Board of Medical Practice for a second term. To the full Senate for confirmation.
All right, discussion? All those in favor, say aye.
Aye.
Opposed? Okay.
Now, Jim, what's the difference between the underlying ones and the ones that aren't underlined in
It's
the?
the sort of the leadership are underlined, and there's a report on their background and why it's important to
Okay,
vote for them. And then the ones that are not underlined are taken together and voted on based on the recommendation from the committee of jurisdiction.
okay,
Yeah,
got you.
okay, so you have someone else.
Right, so I have Susan Jones, who is a physician assistant, member of the medical practice board. She has indicated her desire to remain on the board. Sent me her resume. She's a retired physician assistant with an active Vermont license and 30 years of experience in primary care. She experienced physician assistants, office, Bullock and Dr. Holmes of Rutland, from 2000 to 2024. Physician assistant of the Vermont Board of Medical Practices, 2001 to present. Education is Yale University School of Medicine, physician associate program at the University of Vermont, MS nutrition school in 1991, and St. Lawrence University BS in 1987. Certificates and affiliations, licensed physician assistant in Vermont, NCAAPA Certified American Academy of Physicians Assistants and the Vermont Academy of Physicians Assistants.
Okay, so we've got a position and then we have a PA, and both of those are important within the regulatory environment for the Board of Medical Practice. Oh, are you, would you recommend that we,
I would make a recommendation or motion that we move her to the full Senate to remain on the Board of Medical Practice for confirmation.
confirmation? Okay, good. Discussion, questions? Points of all those in favor, say aye. Opposed? Okay, thank you for your work on this. I know it's hard in the midst of everything else, contacting people, talking with them, understanding that perspective. Just in time.
Yeah, okay. Good. Just got to leave it.
Oh, good. Let me hear. Please, just get yourself settled.
In the hot seat.
Yeah.
Yeah.
It's more comfortable now that it's good.
It
There's
is.
padding on that. seat.
Yes.
We have no idea what
What happens to
chair.
That historic chair. That's moved itself to
My kitchen. No.
And you see it outside on the lawn.
So Commissioner Hoffman, thank you for being here. And I know you've been in our committee a few times and this is an opportunity for you to share with us a little bit about your background and then how your experience so far as commissioner and then maybe why you'd like to continue to be commissioner, what you see as sort of moving along to what are the biggest challenges you're facing. But it doesn't need to be long, just a very brief summary of your experience, where you are now, and what you see going forward.
Sorry.
I know.
All right, experience. So I started in public service about 32 years ago for the Department of Corrections. I was in college I took a probation and parole course and met Bob Smith from Corrections. He's like, oh, why don't you come over? So I applied and I was a correctional officer for just under 4 years. At the same time, I was volunteering for battered women's services. So I was seeing the violence, the domestic violence, and I was working with the offenders too. That's what they were called then. I don't know if they are anymore. But at that point, I was like, okay, I'm coming in too late in the game. I want to get in there earlier. So I started working at Woodside. I transitioned to Woodside and started working with adolescents with challenging behaviors. So I did that for about 17 years. While I was there, I got my master's degree in social work, and then I got licensed as an alcohol and drug counselor. So I was working for FSD, and then I was doing an internship in the neonatal intensive care unit and at Vermont Catholic Charities, where I did individual, family, and group counseling there, and then worked in a school as a social worker also. So those things were all happening at the same time. So I worked at Woodside for a while, and then there was a shift there that was it didn't align with my values. So I thought, well, let me see about moving. And at the same time, I was working on continuous quality improvement. I did some courses in that, and I liked it. I liked measures. I liked assessing and evaluating programs. So then there was an opening at the Department of Vermont Health Access. So I went over there and was the manager for the Clinical and Quality Integrity Unit, and then became the director of that unit. Then it was called the clinical chief, and then deputy commissioner for the Department of Vermont Health Access. And in that role, I oversaw the data, clinical quality oversight and monitoring, special investigations unit. So like a wide breadth of services. It was really cool for a long time. And then this position came up at DCF, And it's like coming home because I had started, I started there, and I think I really appreciate working with children, and I have that perspective. And there are a lot of things that are happening at DCF now that I can influence perhaps. And that's exciting to me. That when I came on, it was right when the government shutdown happened, and it was a quick move to get SNAP benefits to people who weren't getting benefits. And when I saw how great the team was doing that, quick moves and figuring out how to make it happen, it just was so exciting to be a part of a team who can act so quickly. And then the passion of you've met a lot of the folks that work at DCF. To work with such a team, it's just been an incredible experience for me. I mean, public servants across the board are awesome, but they're really great here, and I really love the work. So I think I covered everything in that.
I think you did, and with appreciation for how you did it. I do have one question, and that is, so just share with us what you see as the 2 or 3 biggest challenges facing us right now within your environment. And I know
It's really hard to pick them.
I know we just passed 9:38 out, so I'm sure that's not.
That's a big one. That's huge. Homelessness is huge. And then I think preventative care and foster care and that are there therapeutic interventions that you can do early on, like through foster homes, I think is huge. In the homelessness, of course, that counts. That's shelters, that's the GA pro, so that whole, and then benefits, ESD. So I think in just that response, it covers a lot of priorities. I know in the CDD world, fingerprinting, getting the background checks turned around quickly, that's huge. And then updating the IT systems within across the department.
Is the background check, is that getting figured out? Because it is it's been a big issue.
Yeah, Janet McLaughlin from CDD has been amazing right now.
Good. Yeah. Oh, it's great. And IT is also huge.
Yeah.
Amazing. Other questions for the commissioner? Is there anything that we need to know about your work or the issues facing you that we can help? How can we help besides not doing anything?
I think culturally there has been not necessarily in this committee, but there seems to be some kind of almost adversarial relationships with some we're all public servants, and we do this, I do this, my team does this, the folks at DIVA, I know that AHS across the board, we do this because we care about people. And I think that's why you and this body, everyone does it. And if we all could just be more collaborative and not this committee, I'm not saying this committee.
Well, you have to remember, we put the word collaborative in every single one of our healthcare transformation bills.
I love that.
Yeah.
I love that.
It's
and I
gotta
think
be
it's
there.
so important across the board, advocates from everywhere. We all are working toward the same thing, and sometimes we're at odds with certain pieces, but ultimately we all have the same goal, is to help Vermonters.
Thank you. Thank you for that. Other questions, committee? We have worked with you this session and really appreciative of your help with the bills that we've passed.
Yeah, same. Back at you.
We don't have any difficult questions today.
Okay, great.
We're really just fine with your coming in, and thank you for doing that.
Okay, great. Great, we all set. Thank you. Thank you. Yeah. Have a great day.
You too.
You too.
Oh,
But
sorry.
don't think that you're always going to get off this easy.
I don't think so for a minute.
All right, take care.
Bye.
Good. So this was your,
I don't know how these landed on my desk, but yes, She, I
I
got,
volunteered, Senator.
I did, okay. I will make a motion to approve the appointment, recommend the appointment. Some Jenny's whispering in my ear. Go ahead, you make the motion.
No, go ahead. It's just recommend, to the full Senate. that we
Recommend to the
confirm.
full Senate that we confirm Sandy Hoffman as Commissioner of the Department for Children and Families.
Perfect. Yeah, discussion. Okay. It's been, she has a really broad background that is extremely helpful today for what we're going through and working with the judiciary, and, public safety. So it's really.
I agree.
Okay. All right. All those in favor of sending the Sandy Hoffman? Aye, opposed? We're good, and again, we can, talk with Senator Cummings.
I will.
That'll be good. And we're gonna take one more, and then we're gonna move on, because I know Senator Ingles is here with his proposed amendment. I will hold mine till, later. I have Owen Foster, so we can save that. And we'll look at what Senator Ingles has for H660. So Senator, thanks for being here.
Thank you. Thank you for having me, Madam Chair, Vice Chair.
And do you have copies?
Well, I was hoping I can pass.
Yeah. Okay, good. I've read it.
Yeah.
And you sent
Okay.
it, which was very nice.
Yeah, I sent it. Yeah, I wanted you to to be able to see it. I don't, as a fellow chair, we, do respect that it at least comes forward. I just got a funny story. The, previous witness, Miss Hoffman, we have the same name and I spelled the same way, everything in our area. And when I heard that she was confirmed I congratulated her. It kind of shocked me a little bit. I said, well, so I congratulated her and I carried it back. It wasn't the same person. She said, so anyways, I think that was, yeah, anyways.
Oh, you have a credit, bro.
Yeah, exactly. So,
Make someone feel really.
yeah, really good. So and I hadn't been the only one that had congratulated her. So, H660, I think there's, 3/4 of, in my own assessment, which is dangerous at times. I get it. I think that it's a great bill. I just, as I had spoke out yesterday, I just think that there are some things in there that I would like to see changed. And what I propose to do is to take the $850,000 of the needle program and the $1.1 million for the proposed idea in Burlington and to move it into recovery houses that are affirmed by the state. And that's really all that I've done. I just believe that I've done some research. 45% of the nation is experiencing reductions in drug use now. Most of the states that are involved are not using the opioid or not allowed to use the opioid settlement funds for anything but for true reductions. Most of them are going to recovery home. And I think that we are on the path in that direction. And I think it's time that we we try to lead the nation so many times in so many different directions. And I think that we could lead the nation in having people fully recover from addiction. So if that's where it is, I appreciate your time. I appreciate allowing me to come in and present the amendment. And I don't need to take a lot of your time. It's pretty straightforward.
Okay, so thank you. So what this represents is, and Katie will confirm, this represents removing the $850,000 from the syringe services program, the $1.1 million from the OPC in Burlington, and placing it into recovery.
Yes, that's it.
And we'll see where that goes. I see it right there.
Okay.
All right.
Well, thank you very much. Thank you for taking the time. I appreciate
Yeah,
it.
no,
greatly.
thank you. We also appreciate your passion about continuing to reduce opioid addiction. We do appreciate that.
Well,
We
it's like this, Senator. Senator Morley and I have a great friend that passed away a year ago from cancer. And great friend. We grew up with her, grew up with a family in the prime of her life. She won the battle in high school, but you never win the battle. And if you would have said to her, Paula, we'll give you 90 days to be better and be cancer free. Would you take that? And she would take that every time. And I think that most people would, but there is a, most people are, as you are very well aware that your committee, you deal with it. People are in denial that they're an addict. People are in denial about a lot of things in life. People are in denial that they're not healthy. People are in denial that they're too heavy. People are in denial that they have bad habits. And people that are addicted deny the most, and they cause a lot of harm. People that have no source of income have $1,000 a day drug habit, and that money comes from someplace. And it is, it affects the homelessness situation that we have. I hate to throw statistics out there, but a lot of those folks are addicts, and I just think that we owe it to them and to Vermont to do all that we can do to make those 170 deaths down to zero. And that's my passion.
Thank you.
Thank you. Thank you for having me in.
All right. So we've got two more proposals, one from Senator Heffernan and one from Senator Norris. So Senator Heffernan's is on,
Section 16.
of which bill? 611, 657,
Yes.
657. So we're gonna go to Senator Norris first.
He's the senior senator.
All right.
Morning,
Thank you for
Senator.
being here. Good morning.
Carolinas for the record, Senator Bob Norris, Franklin County. Before you got off this morning, what seems to be a less than controversial amendment. Basically, you heard my concerns yesterday on the floor, and I've got a few other co-sponsors on here, but I guess I'll just dive right in. So if you have any questions afterwards, section 6A. Syringe recovery on or before December 15th of 2026, the Department of Health shall submit a plan to the House Committee, Human Services and Senate Committee on Health and Welfare containing recommendations for the implementation of one or more syringe recovery models throughout the state to enhance public health and safety. The plan shall require syringe service providers to report to the department on the percentage of distributed syringes that are returned to the provider or otherwise collected. I do this as simply nothing more. It's not going to solve our concerns, but it's a starting point to start collecting that data. Doesn't change anything in the bill, but I feel more comfortable if I start receiving data from these entities who receive the syringes and pass them out. So that's my concern, but I expressed that on the phone yesterday. So
Yeah, but, and so the plan, will have some way for syringe service providers to actually recover syringes from the Department of Health. And, okay, questions about the proposed amendment, and we do have Department of Health up on the screen with us, so this is good.
Senator Norris, so it sounds like to me you're just trying to track. So you know how many surgeries are going out. And then you're gonna be able to track how many have come back in through, I can't remember what it was called, they call it something, you drop the syringes
Oh, the
off.
charge.
Right, and so, where's the differential going? Is that kind of what you're driving at here?
yeah, in an attempt to answer your question, I don't know how many syringes are going out.
No, I don't either.
But if I did know that, and more importantly, I don't know how many syringes are coming back in. So as I said, we just find them in our ballparks and football fields, on my lawn and my driveway. So I know they're not all going back. So I just want to know what percentage you may not be coming back into it.
And so what we also don't know is that the syringes that are purchased through the program in the state are the syringes that are on the ground, because a number of folks actually buy syringes over the internet and they get them in different ways. So that's a problem, but it's also something that you've identified a little bit here. Knowing the number going out, and then if they collect a number in, you know, how many of theirs are left there? So it's, how do they do that? That's the question.
Yes, and in response to that, I'd like to think that it's a small percentage of those syringes find along roadside that may be purchased by these individuals who toss out onto the lawn, because
We
most
don't
of these folks need
Yeah.
some help. And so they can't afford to buy these syringes, so they go to this so-called needle exchange program, which I'm concerned about whether or not we're actually doing the exchange within this program. That's just the point.
Okay, so what I'm going to do is I'm going to turn to the Department of Health for a comment, and then we'll, that'll be it. So Shayla, thank you for being here.
Thanks for having me, everyone. Hi, I'm Shayla Livingston. I'm the interim deputy commissioner for the health department. So the health department is not opposed to this amendment, but I just did want to let the Senate know about what we're already doing. So this winter, fall and winter, with the governor's work that he did with the city of Burlington, the health department was part of that work, and we did a revamp of the programming with syringe service programs around return rates across the state, not just in Burlington. And so we now have requirements in the grants for there to be a 95% return rate. So we're building to that. We're not at that immediately, but that is what we're working with the grantees to get to. We do count that, we do track it. We are now having the programs report that by region, and we should have data by the time that this report or recommendation is being asked for, and we would definitely be willing and happy to share that with the Senate. Additionally, there are communities that have already started their own programs with our support around recovering syringes that are disposed in the community. Burlington is one of those. Barry was actually a leader in that work, and other communities are interested in that. We have toolkits for that, and support and training for how to do that safely. And lastly, I would say is really important that when we work with our clients who come into these programs, that the programs work with them to know and learn and understand how to safely dispose the needles if they cannot carry them back or bring them back to the site. So sometimes that is also dangerous. And so, sending them with safe disposal kits or, safety instructions on how to dispose them safely is also part of the work that we are doing with these programs. So, really a new focus on that this late fall, early winter, really supporting the programs to enhance the work they're doing with clients. And again, very much in alignment with the amendment, happy to come back and report on it, but just wanted to reassure the Senate that we are already working on this and supporting the programs. The last thing I want to say, just so folks know, is that for prevention of the spread of disease, we really want to make sure that we're working with clients to have access to this. And so while we want to support this, and we understand that the communities cannot continue to tolerate the level of litter that they're experiencing right now, we want to make sure that we do it in a way that's supportive so clients continue to come and get these important services. So again, not opposed to the amendment, but already doing this work, happy to come back and report out on it.
Okay, thank you for that. And I do know that the program, the syringe service providers are providing education. They're providing sharps containers. There's a whole lot going on. They're providing testing strips for xylazine and fentanyl. So there's a lot going on. And as you have said, there are programs that are already pilot. I do know that the Howard Center also had a program for doing this, but they've ended that. But you're not opposed to this amendment because it seems like it will enhance the work that you're doing. That's a question.
I don't think it will enhance it, no, but it's in alignment with it.
Okay, all right.
Can I ask a few questions?
Yeah, go ahead.
Shayla, when you say you're not opposed, is that the same as you support the amendment? Because I got in trouble recently when I conflated those two things. So do you support the amendment or are you just not opposed to the amendment?
I'm not opposed to it. I mean, we are so happy to come back and tell you all about this work, and especially once we have more data next year. Do I need the amendment? No.
Right. And can I ask one other question?
Sure.
Can you really briefly speak to the fact that the needle exchange program reduces the spread of disease? Because that's not something that we actually talk about very often.
Sure. So the genesis of needle syringe service programs and having syringes available to clients is to reduce the spread of infectious disease. So, HIV is maybe the best known, but hepatitis C is more common here in Vermont. There's all sorts of bloodborne pathogens that can be spread by sharing needles in the act of drug use. And so when we think about ensuring reduced burden on humans and improved health outcomes, providing clean syringes is a harm reduction method of reducing the spread of infectious disease. That is its primary purpose. That is where this kind of programming started and came from. And, it's really, really still an important tenet of it. We have recently shifted these programs to be managed by the Division of Substance Use here at the Health Department because we acknowledge that most of the sort of other problems being faced by these clients have to do with substance use. And so there's a lot of other harm reduction services that these programs provide to clients when they walk in the door. The chair talked about testing strips, referrals, naloxone, education around using more safely. All of these things are important aspects of the program and pieces that we really want to make sure are in place for folks who walk in the door.
We're good. We're good, Shayla. Thank you. Our time is really limited.
Really
We
limited.
need to move.
Just very
Senator
quick question.
Morris.
Yes.
Yes.
Sheila, you weren't here yesterday, but my concern is the other end of the spectrum here. I appreciate the fact you're saving lives, but when you said that your goal is 95% return of these syringes or whatever else, if that doesn't happen, what's the repercussion?
Sure.
Okay.
So we use, sorry.
So I would say that's a great question. And if you can get us a quick answer, perhaps by text or email, that would be helpful because we have another person waiting to provide. Senator. It's a good question.
Thank you.
Not meaning to interrupt. Don't ask it on the floor. Unless we
I still got one question needs to be answered on the floor.
You got it, don't you worry. I've got so many answers for you. Thank you, Shayla. Appreciate your time very much. All right. Senator Heffernan, thanks for being here.
Thank you, Chair.
And you're here to talk about.
For the record, Senator Steve Heffernan, Madison County District. I'm here to ask to add to 86657 on section 16 to add one more person to the group, to the working group. Here is the
This is the working group to explore
to explore and to help with the pregnancies of
pregnancies. Yeah.
Okay, so I'll give a quick spiel. And the reason I did this, Planned Parenthood of Northern New England testified in 2023 that if pregnant women decide to carry to term, Planned Parenthood would not refer them elsewhere. And that's why I'm asked, there's 9 groups throughout Vermont that would probably want to be a part of this. I know for a fact that the Women's Crisis Center in Middlebury does want to be part of it. Others have to go see their board. And what they do is they empower individuals to make informed choices, pregnancy confirmation with ultrasound, pregnancy wellness, childbirth education, parenting education, healthy relationships, and life skill education, and maternal assistance, offering compassion, hope, practice, help for facing pregnancy, parenting, and relational challenges. They also offer help when the person decides to abort, because often or not afterwards there's a lot of
Yeah.
I believe that it's very important we have this on the group as well to be there to offer the support. I know your concern was that they were all pro-life and that what that sometimes represents. I can assure you that they are pro-life, but they are women first in their choice. And then whichever they need to offer, they love to help when they want to see pregnancy all the way through. They also like to help after an abortion to help with any problems that may come with that. So I think it's important to have these people in the group as well. I only can speak for Middlebury because I did speak for them.
That was my question. I know that you had suggested both two different.
Right, and, I know that, Aspire really wanted to, but they want to meet with their, board and decide.
Okay.
So we'll strike, the 13th, but.
Yeah, I was gonna suggest if we could do that, and there may be something that happens between now and when the bill returns to the House. But I think you're having talked with the Women's Center in Middlebury. That sounds like they have the services
They do.
and yeah,
They do, and no matter which way, they're there to support, the individual through a very tough time if they have to.
okay, so what I'm gonna say right now, it's different from our process, it's so short on time, but I'm gonna suggest that if you could modify this proposal amendment to have just the Women's Center. And then without objection committee, would we straw poll this one? Okay, with this one? With the Women's Center. Okay,
no,
come back.
but that doesn't matter. One of four sitting at the table, so.
All right, Senator Heffernan, thank you.
Yeah, thank you.
I would
For your time
suggest that you, change it and then this committee will have a discussion and vote at some point. Be good.
Thank you. Thanks, Steve.
Yeah, that we did. You'll send that to me?
Yeah.
Awesome, thanks.
Okay, so, we're gonna see the green light in a little bit. Hasn't happened yet, thank goodness. Senator Engel's proposal to, rearrange the funding here, I'm not something that I think it comes out after a whole lot of work by the advisory committee, by the Department of Health, by us, and by the House. So I am, for one, I can't support this, listen, the committee has comments.
I mean, I would love to be able to spend more time on that because as far as I'm concerned, the work that we do in this committee has always been around science, right? And addiction for us is a disease. It's not a question of being in denial or not in denial. So if it's treated as a disease, then no, I don't support this amendment. Because it's already,
We don't know what effect it has on recovery centers across the state to add all of this money. Don't know about that.
right.
So that's two not favoring straw poll. Straw poll, those for it.
Well, as you know, I'm not a big fan of the sort of you can see part of it, but one of the recovery houses from the testimony we received. They're very important and they get people.
We all understand that. The point is now we would be loading in money where there's been no testimony about how it's utilized or affected. We also know that we have another proposal of amendment, probably should have gotten up first, on looking at the syringe service program and how to to reduce the problem that seems to be the biggest problem. That
one I have no problem with.
Okay, don't have a problem with this one, but if you do this one, you don't have a problem with it at all. It isn't there. Yeah. So,
I mean, I think Shayla made a good point about trying to minimize the spread of disease. That's one of the reasons why we have needle exchange.
right. It's really important.
So,
So on this one, on the Norris proposal, could I see a straw poll for this one?
can you remind me exactly what it does?
It has a plan, Department of Health will have a plan to make sure that needles are returned
Okay,
with a 95%.
It sounds like they're already doing.
sure.
They're doing it because we talked about it. And it's because we did have a program with the Howard Center, and now they're doing it again.
Just you
So I am really loath to put this one forward.
loaf.
Loath. L-O.
That we're in here.
The road, the road to recovery is not a straight line. I mean,
It's true.
it's up and down and,
Yeah.
so I do not support that one. Okay.
I'll ask Senator,
You can ask me.
and do you support it?
No.
And I see he's on the fence over.
Well, I'm split on it, but
Okay.
at this stage, yeah.
All right, good. So we'll, then on the, we have to go upstairs. On
Yeah.
the Women's Center, let's hold that thought, but it's not, I think,
I'm for it.
I think it's fine.
Yeah, I know it's fine.
I don't, but that's okay.
Okay, straw poll. Okay. All right.
Also, who's doing Sandy Kaufman on the floor? You are. I do, I'm doing
Yes,
Sandy.
yeah,
and
once
Sarah.
you,
Okay.
once you have it, you've got it.
And are we off